So the second ancestry is are what we call the transporter channels. So the Weimai are the vessels of the second ancestry, and they are about how our life unfolds. How does the Jing of the Chong, or the curriculum that we are born with to live out, how does it unfold? How does that Jing create the experiences in our lives that make it possible for us to kind of work the program that we came in to be a part of or to learn from? The second ancestry, the four transporters are comprised of the Yin Wei, the Yang Wei, the Yin Chao, and the Yang Chao. The Yin Wei pericardium 6, the Yang Wei Sanjiao 5, the Yin Chao kidney 6, and the Yang Chao UB62. And so we're talking about how does our life unfold? How do we experience the plan that is laid out at the moment of our conceptions? The Weimai measure those experiences as we age and help us to connect to that sense of self. So it's how we transition over time, how we grow from experiences, how life sort of plays out in that bigger arc or the bigger picture. And it relates to the fire element, the pericardium and the Sanjiao, which also relates to that ministerial fire, that notion of how our physiology functions is also related back to Jing and how our Jing unfolds through time. Are we burning it all out at once? Is it something that is following a slower, more measured trajectory based on the way we're experiencing our lives? So as I mentioned in the prior slide, these are the four transporters that we're talking about. So when we talk about the Weimai, we're talking about these trajectories that run up the side of the body and right up the center of the body. The master point of the Yin Wei, as we discussed, is pericardium 6, and of the Yang Wei is Sanjiao 5. The Yin Wei is a vessel that we often turn to for imbalances in the chest and heart. One of the first things you learn, even from a Zong Fu perspective, is that pericardium 6 is for tightness in the chest, for anxiety, for constriction, for lack of blood flow. So the Yin Wei relates profoundly to the flow of qi in the chest and in the heart. And for that reason, it also relates profoundly to the flow of qi and blood in the uterus. It is a treatment that it benefits people who are experiencing acute emotional distress. So if somebody is having palpitations and stress around, anxiety about what's happening and is manifesting on a physiological level, the Yin Wei can help it to calm that down in the moment. Over time, the Yin Wei is beneficial for menstrual disorders, particularly if there's any accumulations of blood stasis involved. So fibroids, polyps, endometriosis, things like that can be addressed with the Yin Wei, or at least, in part with the Yin Wei. Genital conditions, sperm decrease, especially if there is an overload of toxicity in the system. The Wei vessels support neuropathies, B syndrome, especially when there's a neurological component to that, like numbness or tingling. And it supports the Yin Wei supports Yin Qi. And in the same way, I think of the the yin and the yang wei, almost like the guizhou tong of vessels, right? They harmonize the yin and the wei for one another. And so the balance between the internal and the external perceptions that one is experiencing are impacted by the yin and the wei on an energetic level. And on a physiological level, it's how is our immune system functioning? How is our autonomic nervous system functioning? Are we hypervigilant or are we overly slack? That kind of presentation. The yang wei supports patients who present with things like backaches, headaches, musculoskeletal pain, joint pain, ear and hearing problems, colds and flus, things related to the wei qi. So again, when there's that sort of like imbalance where internally there's an insufficient amount of resources, externally maybe the wei qi begins to suffer, people start getting sick, and you can shore it up with these vessels. The points on the yin wei, pericardium 6, which is the opening point, and as we've discussed, you could treat the yin wei without the opening point. It's not required. Kidney 9, which is the she cleft point and the first point on the trajectory. Spleen 13, 15, 16, liver 14. So these are all points that relate to supporting spleen qi, supporting liver qi stagnation, that liver overacting on spleen kind of a presentation, which is that sort of stress and anxiety that presents itself as can be a yang wei pattern. Ren 22 and 23, and this is entirely repeated for some reason, so that's that. Okay, and then the yang wei, Sanjiao 5, UB 63, gallbladder 35 down to 29, liver 14, SI 10, so up on the back and the shoulder, the pathway runs over that way. So things that gallbladder 20 and 21, anything that's pertaining to like tension type headaches, muscular headaches, scapular pain, you can use the yang wei for all of those. And then gallbladder 19 all the way through 14 and gallbladder 13 as well. The yang wei, admittedly, is a vessel that I will use points along it. It's very rarely my focus vessel when I'm talking about the reproductive system. In terms of the chow mai, we're talking about the master points of the yin chow kidney 6 and the yang chow UB 62. And the chow vessels are the yin and yang heel vessels. They start at the malleoli on either side and they end at UB1. They're what we call heel to head bridges. They are distributors of vital substances, particularly of yin and yang, but they're also the vessels that give us our positioning, our stance, and our orientation in the world, our polarization in the sense, is there discrepancy between our inner and outer reality, between the foot we put forward and the foot that's really inside? The chow vessels also have to do with experiences that take place in the present moment and helping to bring people back to or keep them in the present moment, which can in and of itself be very, very effective for patients who are going through a long, protracted fertility struggle, because it's very hard to stay in the present moment. And it is the constant reaching out for obsessing on things that happened in the past and I should have done it differently and it wouldn't have gone this way, or obsessing about the future. I just want this to be over. I just want to have a baby. I'm not going to be happy until that happens to me. So the chow vessels help to kind of reorient people in the present moment and try to get them to start viewing things exactly as they are, as opposed to how they wish that they would be. Because when we get stuck in that loop of, I just wish it was this something else, then you're taken out of the present moment, and it's very hard to maintain or achieve sympathetic downregulation when that's the case, because there's an internal brewing of rumination and stress that's just on a loop, and it has to be stopped. So the child vessels can help bring people back into the present moment by cutting off that looping feedback, and getting them to stand properly in what's really happening right now today. So the yin chow relates to arch support. It relates to the notion of internal alignment, and in a physiological sense, those deep stabilizing muscles in the feet, in the legs, and in the core relate to the alignment of the yin chow. So our posture, our ability to stand upright, to hold ourselves upright. In addition to that, a very vital role of the yin chow is the distribution of yin throughout the system. And as the vessel ends at UB1, it relates to vision and to the brain, enters the brain. The yang chow, on the other hand, is more like a big framework for our large muscles. It has to do with locomotion, how we physically move through the world. Does somebody walk with a limp, or is their gait just messed up because of something physical that took place in their body, or something congenital? That could be a function of the yang chow. The yang chow obviously also plays this big role in the distribution of yang, and also relates to vision and to the brain. So here's the point trajectories. The yin chow is teeny tiny, and it really allows you, when you're working with the renmai, if you choose to couple with the yin chow, to access points along that trajectory that are very resonant with and beneficial to the overall distribution of yin and the balancing of hormones. UB1 is a point that I will only use UB1 if I'm really, my primary focus is a yin chow treatment, and I'm choosing to use that point because I want that person to have deep insight, that I want them to really see themselves and where they stand in a moment. It's a tricky point to needle, and make sure you know the way that needs to happen. I can't really teach you in this setting before you use UB1, but it is a profound point for helping people really look inside and get a clear sense of, like, yes, this does or doesn't resonate with me, or this is or isn't what I want. The yang chow trajectory is much bigger. It runs up the entire side of the body, and again, is going to ultimately relate more to musculoskeletal conditions, and from a fertility standpoint, the distribution of yang. We're not going to spend too much time on the yang chow. But from a comparison standpoint, you can think of the yin chow as something that you would treat when you're seeing things like accumulations in the abdomen, fibroids, cysts, masses of any kind, chronic UTIs. Whereas the yang chow is more of things accumulating in the head, migraine headaches, or I think even more so tension headaches, pain due to musculoskeletal trauma, that type of thing.
Okay, and I think there are a couple questions.
Wouldn't going for a good long walk or hike get people to be back in the present moment as regarding the chow vessels? That would help some people. I can't say that would help every person, but absolutely, one of the things that helps people get back in the present moment is when they put down their devices and get outside a little bit. So absolutely, yes, that could help, but maybe somebody who has like chronic foot pain or other issues that make walking hard, that might stress them out more. So obviously case by case, but yes, the idea of like hiking and standing in yourself and moving forward and getting outside and all of that gives you sort of clarity of thought, for sure. That is a way that you could support your patients in recommending that they, if you feel like that's what's going on for them, that there's a chow imbalance, then helping them to, really get into their bodies and move in a physical way that would certainly help from the perspective of the yang chow, and from the perspective of the yin chow, potentially in that it would create an opportunity for introspection.